Depression is more than just feeling sad or having a bad day. It's a serious mental health condition that affects how a person thinks, feels, and acts. Many people experience occasional sadness, but depression is persistent and can interfere with daily life. It can make even simple tasks feel overwhelming and can impact relationships, work, and overall well-being. Understanding depression is the first step toward recognizing its impact and seeking help. In this video, we'll explore the symptoms, causes, and available treatments for depression, aiming to provide clarity and support for those affected. Depression manifests in a variety of ways, and symptoms can differ from person to person. Some of the most common symptoms include persistent sadness, loss of interest in activities once enjoyed, and changes in appetite or weight. People may also experience trouble sleeping or sleeping too much, fatigue, and difficulty concentrating. Feelings of worthlessness or excessive guilt are also frequent. These symptoms can last for weeks or even months, making it hard to function in daily life. Recognizing these signs is crucial for early intervention and support. Depression doesn't only affect the mind, it can also have a significant impact on the body. Many people with depression report unexplained aches and pains, headaches, or digestive problems. These physical symptoms often don't respond to typical treatments and can be frustrating for those experiencing them. Sometimes these bodily complaints are the first signs of depression, especially in cultures or communities where mental health is less openly discussed. Understanding the physical side of depression helps in recognizing the full scope of the condition. Emotional toll of depression can be profound. People may feel hopeless, helpless, or trapped in their own minds. These feelings can lead to withdrawal from friends and family and a sense of isolation. Emotional numbness or a lack of motivation is also common, making it difficult to engage with the world. The emotional impact of depression can be just as debilitating as the physical symptoms, affecting every aspect of a person's life. Recognizing these emotional changes is key to understanding the depth of depression. Depression often leads to noticeable changes in behavior. Individuals may withdraw from social activities, neglect responsibilities, or struggle to keep up with work or school. Some may turn to unhealthy coping mechanisms such as substance use or overeating. These behavioral changes can further isolate a person and worsen their symptoms. It's important to recognize these shifts as they can be a sign that someone is struggling and may need support or intervention. Depression does not discriminate. It can affect anyone regardless of age, gender, background, or life circumstances. While certain factors may increase the risk, such as family history or traumatic experiences, no one is immune. Children, teenagers, adults, and the elderly can all experience depression. Understanding that depression is a common and serious condition helps reduce stigma and encourages more people to seek help when needed. Major depressive disorder, often simply called depression, is one of the most common types of depressive disorders. It involves a persistent feeling of sadness or a lack of interest in outside stimuli, lasting for at least 2 weeks. This condition can significantly impair daily functioning and quality of life. Recognizing the signs and understanding the seriousness of major depressive disorder is essential for timely intervention and effective treatment. Persistent depressive disorder, also known as dysthymia, is a chronic form of depression. Symptoms are less severe than major depressive disorder but last much longer, often for years. People with this condition may feel like they are always mildly depressed, making it difficult to remember what it feels like to be happy. This ongoing sadness can affect relationships, work, and overall enjoyment of life. Early recognition and treatment can help manage symptoms and improve quality of life. Bipolar disorder is a mood disorder that includes episodes of depression as well as periods of mania or elevated mood. During depressive episodes, symptoms are similar to those of major depression. However, the presence of manic episodes distinguishes bipolar disorder from other types of depression. Understanding the differences between these conditions is important for accurate diagnosis and effective treatment. Seasonal affective disorder, or SAD, is a type of depression that occurs at certain times of the year, usually in the winter months when sunlight is limited. People with SAD may experience symptoms similar to major depression, such as low energy, sleep problems, and changes in appetite. Light therapy and other treatments can be effective in managing this condition. Recognizing the seasonal pattern is key to getting the right help. Postpartum depression affects some women after childbirth. It is more than just the baby blues and can cause severe mood swings, exhaustion, and feelings of hopelessness. This type of depression can make it hard for new mothers to care for themselves and their babies. Early recognition and support from healthcare providers and loved ones are crucial for recovery. Depression is often linked to changes in brain chemistry and function. Genetics can play a significant role, with depression sometimes running in families. Imbalances in neurotransmitters, the chemicals that help transmit signals in the brain, are also associated with depression. Understanding these biological factors helps explain why depression is not simply a matter of willpower or attitude. Psychological factors such as personality traits, coping skills, and early life experiences can contribute to depression. People who have low self-esteem, are overly self-critical, or have experienced trauma or abuse are at higher risk. These factors can shape how individuals respond to stress and adversity, making them more vulnerable to depression. Environmental factors such as stressful life events, financial problems, or the loss of a loved one can trigger depression. Chronic stress, social isolation, and lack of support can also increase the risk. These external pressures can overwhelm a person's ability to cope, leading to the development of depressive symptoms. Hormonal changes can play a significant role in the development of depression. This is particularly true for women, who may experience depression during pregnancy, after childbirth, or during menopause. Hormonal fluctuations can affect mood and emotional stability, making some individuals more susceptible to depression during these times. Certain medical conditions, such as chronic illness, pain, or neurological disorders, can increase the risk of depression. The stress of managing a long-term health problem, along with physical discomfort, can take a toll on mental health. It's important for healthcare providers to consider the connection between physical and mental health when treating patients. Substance use, including alcohol and drugs, can contribute to the development or worsening of depression. Some people may use substances to cope with their feelings, but this often leads to a cycle of worsening symptoms. Substance use can also interfere with treatment and recovery, making it important to address both issues together. Recognizing depression can be challenging, especially because symptoms can develop gradually. Friends and family may notice changes before the individual does. Early recognition is important for getting the right help and preventing symptoms from worsening. If you notice persistent sadness, loss of interest, or changes in behavior, it may be time to seek support. Seeking help for depression is a sign of strength, not weakness. Many people hesitate to reach out due to stigma or fear of judgment. However, talking to a healthcare provider, counselor, or trusted friend can be the first step toward recovery. Support from others can make a significant difference in managing depression. Diagnosing depression involves a thorough assessment by a healthcare professional. This may include a physical exam, interviews, and questionnaires to evaluate symptoms and rule out other conditions. Accurate diagnosis is essential for developing an effective treatment plan tailored to the individual's needs. Depression is treatable, and many people recover with the right support and treatment. The most effective approach often combines several strategies, including medication, therapy, and lifestyle changes. Treatment plans are personalized based on the severity of symptoms and individual preferences. Early intervention increases the chances of a successful recovery. Antidepressant medications can help balance brain chemicals and relieve symptoms of depression. There are several types of antidepressants, and finding the right one may take time. It's important to work closely with a healthcare provider to monitor side effects and effectiveness. Medication is often most effective when combined with other treatments, such as therapy. Psychotherapy or talk therapy is a key component of depression treatment. Cognitive behavioral therapy, CBT, and interpersonal therapy are among the most effective approaches. Therapy helps individuals identify negative thought patterns, develop coping skills, and improve relationships. Regular sessions with a trained therapist can provide valuable support and guidance. Lifestyle changes can play a significant role in managing depression. Regular exercise, a healthy diet, and sufficient sleep can improve mood and energy levels. Reducing stress, building a support network, and engaging in enjoyable activities are also important. Small, consistent changes can make a big difference over time. Having a strong support system is crucial for recovery from depression. Family, friends, and support groups can provide encouragement, understanding, and practical help. Connecting with others who have similar experiences can reduce feelings of isolation and foster hope. Support systems play a vital role in the healing process. Some people find relief from depression through alternative therapies such as mindfulness, meditation, or yoga. These practices can help reduce stress, improve mood, and promote relaxation. While not a replacement for medical treatment, alternative therapies can complement traditional approaches and support overall well-being. Electroconvulsive therapy, ECT, is a medical treatment used for severe depression that has not responded to other treatments. ECT involves brief electrical stimulation of the brain while the patient is under anesthesia. It can be highly effective for some individuals, especially when rapid improvement is needed. ECT is typically considered when other treatments have failed. Transcranial magnetic stimulation, TMS, is a non-invasive treatment for depression. It uses magnetic fields to stimulate nerve cells in the brain. TMS is usually recommended for people who have not found relief with medication or therapy. The procedure is performed in a clinic and does not require anesthesia. Many people experience improvement in their symptoms after a series of TMS sessions. Self-care is an important part of managing depression. This includes taking time for activities that bring joy, practicing relaxation techniques, and setting realistic goals. Self-care also means being kind to yourself and recognizing that recovery takes time. Small steps can lead to meaningful progress. Managing stress is essential for preventing and coping with depression. Techniques such as deep breathing, mindfulness, and time management can help reduce stress levels. Building resilience and learning to cope with challenges in healthy ways can make a significant difference in mental health. Developing healthy habits can support recovery from depression. This includes maintaining a regular sleep schedule, eating nutritious foods, and staying physically active. Healthy habits provide structure and stability, which can help manage symptoms and improve overall well-being. Setting small, achievable goals can help individuals with depression regain a sense of control and accomplishment. Breaking tasks into manageable steps and celebrating progress, no matter how small, can boost motivation and confidence. Goal setting is a valuable tool in the recovery process. Nutrition can have a significant impact on mood and mental health. Eating a balanced diet with plenty of fruits, vegetables, whole grains, and lean proteins can support brain function and energy levels. Avoiding excessive sugar, caffeine, and processed foods may also help manage symptoms of depression. Regular physical activity is a powerful tool for managing depression. Exercise releases endorphins, the body's natural mood boosters, and can reduce stress and anxiety. Even gentle activities like walking, stretching, or yoga can make a difference. Finding enjoyable ways to move your body can support both mental and physical health. Sleep problems are common in depression, but improving sleep habits can help manage symptoms. Establishing a regular bedtime routine, limiting screen time before bed, and creating a restful environment can promote better sleep. Good sleep is essential for emotional resilience and overall health. Isolation can worsen depression, so staying connected with others is important. Reaching out to friends, joining support groups, or participating in community activities can help combat loneliness. Even small social interactions can provide comfort and support during difficult times. Recovery from depression is not always a straight path. Setbacks are normal and do not mean failure. Learning to cope with setbacks, practicing self-compassion, and seeking support when needed can help individuals stay on track. Remember, progress takes time and patience. Preventing relapse is an important part of long-term recovery. This involves continuing treatment, maintaining healthy habits, and being aware of early warning signs. Having a plan in place and staying connected with healthcare providers can help prevent symptoms from returning. Supporting someone with depression can be challenging, but your care can make a big difference. Listen without judgment, offer encouragement, and help them access professional support. Taking care of your own well-being is also important when supporting others. Depression can affect children and teenagers, though symptoms may look different than in adults. Young people may become irritable, withdraw from activities, or struggle in school. Early intervention and support from parents, teachers, and mental health professionals are crucial for helping young people recover. Depression is common among older adults, but it is not a normal part of aging. Symptoms may include memory problems, physical complaints, or withdrawal from social activities. Recognizing depression in older adults can be challenging, but treatment is effective at any age. Stigma around depression can prevent people from seeking help. Education and open conversations are key to breaking down barriers and encouraging understanding. Remember, depression is a medical condition, not a personal failing. Everyone deserves support and compassion. Recovery from depression is possible. With the right treatment and support, many people regain their sense of purpose and joy. It's important to hold on to hope and remember that setbacks are part of the journey. Every step forward is progress, and help is always available. There are many resources available for those struggling with depression. Mental health professionals, hotlines, and online support communities can provide guidance and assistance. Reaching out for help is a courageous step toward healing. You are not alone, and support is always within reach. Depression is a complex but treatable condition. Understanding the symptoms, causes, and available treatments can empower individuals and their loved ones to take action. Remember, seeking help is a sign of strength, and recovery is possible. With support, self-care, and the right treatment, a brighter future is within reach.